Hi, I'm Claudia. I'm a clinical psychologist at Gender Plus, and I'm joined today by my two outstanding colleagues. Do you want to introduce yourself?
Hi, I'm Paul, nurse consultant and manager of the Gender Plus Hormone Clinic.
And hi, I'm Aidan Kelly, clinical psychologist and director across Gender Plus.
And yeah, so it's good to come together today because we wanted to chat because we had some big news. The Care Quality Commission, which is the UK independent health regulator, gave our Gender Plus Hormone Clinic an outstanding rating. And we thought it might be good to meet together and think what that means for our patients and also for healthcare more broadly. Paul, so the Gender Plus Hormone Clinic is your baby. What does it mean to be rated as outstanding by the CQC?
It's amazing, phenomenal, and I'm super proud of all of the team. Yeah, my baby has become an outstanding child. It's incredible. I think we set out to be leaders in this area of healthcare. When we first got our registration with the CQC, we know that we're the only provider of hormone therapy in trans healthcare to those aged 16 and above. And our mission was always to go through the inspection process and come out, if we're honest and transparent, a good would have been good for us. And we know the history of gender services with the CQC. So it was something that we were nervous about, but we really believe that what we've created was outstanding. We've got a full, holistic, integrated pathway for both young people and adults. And we were nervous, and it's right to be nervous. The inspection process is rigorous, and it should be rigorous. And they look through all of our records, our prescription history, how our assessments are undertaken, our health and safety, our infection control, and how we spoke and communicated with our patients and families in the clinic. So it was amazing to get out of the 5 categories to come out with 4 outstandings, which is an overall outstanding. And we know in our area of healthcare that only 13% of those get outstanding. So it is absolutely incredible, and we are really proud. And I hope it sends a message to both our critics, but also the trans community and those that work with the trans community that we provide a real safe service here at the Gender Plus Hormone Clinic.
Thanks, Paul, for sharing that. And you mentioned the registration process a little. Can you say a bit more what that involved to become registered with the CQC in the first place?
So to register, you have to provide your policies, your standard operating procedures, your staff structure. So the CQC need to be satisfied at the point of registration that you're going to be able to provide safe care. And then, of course, then you then become operational, and the point of the inspection is to evidence that safe care is being delivered.
Fantastic. And Aidan, how does this fit with Gender Plus more broadly?
Yeah, no, obviously this is amazing, positive news. Incredibly proud of Paul and the rest of the team for everything that's been achieved. Obviously, the Hormone Clinic is part of the wider Gender Plus organization that kind of came into being around June of 2023. And I guess at that point, there was very much a goal, a wish, an aim to be able to demonstrate that actually this area of healthcare can be done through legitimate means and in a safe, evidence-based way. This is obviously excellent news for us across the wider Gender Plus organization. The Hormone Clinic getting outstanding is exactly what we could have hoped for, beyond actually, as Paul said, what we would have wished for, really. But it's really recognition of all the hard work that's gone into this. We pride ourselves within Gender Plus in the fact that we are a bricks and mortar gender clinic there. You can come and visit us. We've got face-to-face appointments. In fact, they're required as part of this process. And we've got a good geographical spread across the UK and Ireland as well. And actually, it is possible to deliver this in a safe and compassionate, caring way within the regulatory bodies that already exist in England and across the UK. And so actually it's part of our vision to be able to demonstrate that. For far too long, people have felt like the only option outside of the NHS was one which was unsafe, which was a pathway which wasn't properly regulated, a pathway that wasn't properly provided for. And so I think this hopefully sends, as Paul said, the message to the trans community that we're here, we're safe, we can provide the rigorous, appropriate sort of healthcare that you deserve and that you should have access to. But also it reassures our colleagues within the wider fields, that whether that be GPs, mental health practitioners, other physicians and healthcare workers, that they can trust us and rely on us to actually do and provide proper healthcare to often patients who might have other needs and might end up coming into contact with other services. And so that it doesn't feel like they don't know what the service stands for. And so I think CQC registration, and then on top of that, the outstanding rating, really is a really positive signal to the rest of both the community, but also our colleagues and the public at large, actually, that this is an area of healthcare that can and should be done really well.
Thanks, Aidan. And you mentioned kind of how Gender Plus kind of operates and our approach. And how do you think Gender Plus is approached different maybe to some of the other healthcare providers in this area?
I think we pride ourselves on our kind of compassionate, holistic approach. Even if we look at the hormone clinic particularly, I think we're perhaps unique in that we offer kind of mental health review and psychosocial support to those people on the hormone clinic pathway integrated within that. And so it's not a simple assessment and then the psychology or mental health side of it is done. Actually, it's just the beginning of someone's journey in many ways. And actually they're getting the really comprehensive and kind of professional care from the endocrine team. But then there's also that more mental health or psychosocial input that happens a long time. So in the clinic reviews, those are part of that process too. So obviously this is a medical intervention, but often there comes psychological benefits to that as well, obviously, to help people feel more comfortable and happy in both with their body and their gender identity. And so we want to follow up. That's actually what's happening as well. And so it's a real integrated package of care. And so that's how our hormone clinic operates. And then in the front end as well, I guess we, as many people might know, that in addition to doing our assessments, we also offer other services that are related to the patient group or the client group that we see. So there can be mental health support, there can be neurodevelopmental assessment and support, in addition to the main component, which is the gender assessment work that we do too. So we really do take it incredibly seriously, that we want to look after the person that comes to our service and whatever needs they may have, either separate to or in addition to any gender needs that they have. We want to be there able to offer that and meet that need, really. And so I think that's often the message, that the people and patients that come to see us really feel that we really care about them being well and doing well in life.
Thanks, Aidan. And you mentioned the CQC report there, and the report can be actually downloaded on the CQC website. And just going into the report a bit more, Paul, looking at the report and how the CQC described the service, what were your highlights of that report?
I think the report in general is one big highlight. I think for us, obviously the three of us form part of the leadership team. So I think the fact that it was recognised that the whole of the service is well led was something that meant a lot to me as a manager. And it's something that we've brought from our experience in gender services, that we knew that services had to be more integrated and holistic. And in fact, it was something that I fed back to the CAS review, that endocrine should be more integrated into the leadership team overall in gender services. And that was something that was going to be implemented into the new services with the NHS. But actually, we've done that, we've delivered that, and now that's been recognised as being outstanding. As a leadership team, we meet regularly with our colleagues, we feed back, we take on our colleagues' perspectives at all points. So that was amazing to see that recognised. And of course, we're effective as well. We deliver well evidence-based care, and we've been able to demonstrate that to the CQC. In fact, the CQC commented that some of our practices are above national best practice. For example, not only our young people, but also our adults have to be discussed and approved at a referral meeting into the hormone clinic, and we're one of the only gender services that do that. And it's important to point out that isn't a process of gatekeeping. That's to make sure that every single patient has all the care that they need as part of their care plan while they go through their transition, because that's something that means a lot to us as clinicians that work in trans healthcare. And yeah, everyone can read the report themselves, as there's lots of very good comments in there, which is, yeah, heartwarming to read.
definitely. And what about you, Aidan? What were some of the highlights for you from the report?
Yeah, I think as Paul said, the whole report was pretty amazing and quite emotional to read through actually as well. And so I think the bit for me, there's lots of amazing quotes from some of the young people, the patients accessing our care, but also the recognition that what we're doing as a service to address and take responsibility for that kind of expertise that we hold. So in relation to, I'm thinking about things like research plans, also stakeholder involvement, and also plans that we have around a kind of reduced or subsidized pathway as well is something that there's still plans and are hopefully with news to come in very soon. And they're things that really matter to us because we all come from working previously in the NHS. And we believe that this is a service that should be accessible to all. We're in this position because we see this is the best way to be able to share our expertise and knowledge, but we don't shy away from our responsibilities, both to contribute positively towards the research and evidence base, but also to be able to try and address the accessibility issues as well that come inherently with being in the private sector too. So there's recognition of that within the report, which I thought was positive. But I think and we might talk about that in a bit, but the quotes bit are particularly, you read those and your heart melts really. So that's really amazing.
Yeah, I'm just going to focus on some of the quotes now. There's one person who said, "The experience has been amazing. I have felt genuinely cared for by people whose only goal is for me to make a safe and healthy transition." And yeah, like you said, really heartwarming and speaks probably to the approach we take. And I think the CQC rated us as 95% or something like that. So extremely high in terms of caring. What were some of the quotes that you were quite drawn to and mean a lot to you?
Okay. Thanks for that. Yeah, Claudia. So one of the quotes that I really stick with me and was the one where it says, "As a mum, I will be forever grateful for what you've done for my daughter because gender affirming care is life-saving care." That's pretty strong praise, really. So that was quite amazing. I don't know if you have any, Paul, that you
Yeah, there's some that mention about how it's not just what's in the appointment, how we go above and beyond in helping them be signposted to other agencies, help them with their communication with their GP. And I think that's evidence of our approach in the Gender Plus Hormone Clinic, that it's not just come and have your appointment and off you go. That's why we offer our 2-year subscription package so we can look after them well and making sure that they're being signposted to any place that they need to be really to have their care needs met.
Just moving on a bit, Paul, you mentioned something at the beginning that we were a bit anxious about the CQC inspection and the possible rating. So just to address the elephant in the room, were you a bit worried about the negative media attention in relation to trans healthcare potentially having an impact on the rating?
Absolutely. I think it would be silly not to be honest about that, as all of us here have worked in trans healthcare for a long time. You've got to be fully committed to this area of healthcare because it is difficult. All of us have had our names in the press negatively. And we've also been part of a CQC inspection that didn't go so well, which was no fault of the clinicians, actually, when you read the report by for the GIDS service. But actually, all those clinicians have ended up being tarnished with a very negative paintbrush. So I was nervous, both for my professional career, but also for all the patients that were currently under my care. So yeah, it was quite a nerve-wracking process and a very thorough process by the inspector.
Okay, thanks. Also, Paul, at the beginning, you mentioned something about shared care with GP. So given that we have this outstanding CQC rating now, how do you think that will impact on practice with GPs?
So I really hope GPs are reassured, not just by us being CQC registered, but also now outstanding and the only provider for those aged 16 and above in the UK. So for those that are on long waiting lists, they are opting to come into private healthcare. And for a lot of them, shared care is their overall aim, as it is with us here in the Gender Plus Hormone Clinic. So I hope it reassures GPs. Shared care, for those that don't know, is what it says on the tin, really. It's shared between us at Gender Plus Hormone Clinic and your GP. So we write to GPs offering them to opt into shared care. They get a shared care document which spells out exactly what their roles and responsibilities are and what the roles and responsibilities are of us here at Gender Plus Hormone Clinic. So we have overall leadership over the patient's care. We are responsible for monitoring blood results, responsible for changing hormone doses. But what we ask the GP to do is to prescribe their medications locally. And that is the aim long term for all trans people. Once they've had their hormones titrated, they've got to a safe level of hormones that they would be discharged over to the GP and reviewed annually, as is set out in WPATH practice guidelines.
And a question for both of you, really. Why do you think GPs might be worried or a bit anxious to go into shared care?
I guess from my point of view, I suppose with that one, there's lots of talk and misinformation in the media, and there's lots of scaremongering and fearmongering in the wider medical healthcare spaces at times, that somehow this piece of work is made out to be risky or far more complicated or complex than in actuality it is. And I think what we're trying to do is own our expertise, own the bit of this that we know that we can do really well, and support GPs in the bit that we know they can do really well. That's the kind of localized holistic care that they know their patients, they know what's available locally, they know having minimal impact in someone's life, so they can go into the local GP practice to get an injection or to do their bloods or to collect a prescription. Obviously reduces burden, but also helps with people who might have other additional needs as well. It helps them to access the healthcare that they need. And although we do have quite a good regional spread in terms of London, Birmingham, up in Yorkshire offices as well, we recognize that people have to travel for that still. And so if we can have that localized care, that really makes a big difference. And so I understand why there might be worries and fears, especially if you should judge everything off the media, but hopefully by seeing that CQC stamp of approval and outstanding rating, then that can reassure GPs that, you know what, these are professionals, experts in their area who are doing it and delivering a really good service. And so actually that should hopefully reassure them that these are people that we can trust to support our patients, really.
Yeah.
And just to add that some communication I've had from GPs, they've wrote to me just to say they're nervous to enter into a shared care because they've had experience of other providers not being approachable for questions, and they feel like they've been left holding these patients and not knowing what to do. And we know that's with unregulated providers, both in the UK and offshore. So that's something that I always reassure GPs that I would never do that. Obviously, we're now accountable to the CQC, but I am also accountable to my own Nursing and Midwifery Council, and just me as a person. It's just not in my makeup not to care for somebody. So I reassure GPs that we would hold them with us and answer any questions that they have.
Right. So might there be any benefits to GPs to work with us on a shared care basis?
Absolutely. We also offer training and education to GPs. So GPs that say that they're not experienced, and as Aidan talked about earlier, a lot of GPs are scared off about this area of healthcare because of all the politicization that's happening about trans healthcare. So we offer guidance and training and education. The benefits to the patient are vast. As Aidan said, they can go to their own local GP. They can have any injections administered locally. I have people traveling 3-4 hours to come and see me for a 5-minute injection because a GP won't do shared care. And some of these people are taking days out of employment, days out of education. So for a patient to get shared care, yeah, the benefits are vast. From a cost perspective, and although we are a private independent healthcare company, our goal is to get everybody back onto the NHS and make this cost effective. So again, if you're under a shared care, then you don't have to pay private charges for your medication either. So there's lots of examples about why shared care works. And we know that shared care works for all areas of healthcare, both in the NHS and private. Trans healthcare shouldn't be any different.
I guess there's one thing I'd add to that as well. We actually have really good take-up rates in terms of shared care already within the clinic. So at the moment, we get about 70% of patients that start in our hormone clinic pathway that have NHS GPs doing shared care with us. So for the vast majority of people, they do get shared care with their GP. So that's pre-existing, but we're aware that there's always challenges into that. And we're hoping that our outstanding rating is going to bring that number even higher, really. And so we're not resting on our laurels. We think we can always aim for 100% and get that as good as we can, really.
So Bringing this to a close, I'm just thinking now that the CQC has given us this outstanding rating, what's next?
I think we carry on doing what we have always done, both in our roles in the NHS and now with Gender Plus, which is giving our all to the trans community. We know that this is an underrepresented, undervalued community that deserve access to healthcare. And it's our mission, and as we have done by setting up Gender Plus and Gender Plus Hormone Clinic, that those that can access us. I think we're just going to get, when you look at NHS waiting lists, and waiting lists are extending from 6 to 9 years, depending on where you live, then I think Gender Plus will only get bigger and become a leader in this area of healthcare. And I know that we're really keen to present research. And again, that's probably something that we're going to be presenting before the NHS services, because we know that we're up and running and established with an outstanding CQC inspection result.
I'd second that. I think next year, our big things are the reduced cost pathway and the research program that Paul's mentioned as well. And so I think there are big things for 2025. And so hopefully, who knows, this time next year we're talking a bit more about the kind of how those have gone and these sorts of things. But we're not just settling for where we are. We've got big plans and we want to make a big positive influence in the area of trans healthcare in this country.
Thanks for joining us today. If anyone wants to find out more information, you can go onto our website, genderplus.com, or also go on Instagram for any updates. Thanks.
Thank you.
Cheers.